for the debate. I recognize the member from Kitchener South Hesperia.
Thank you, Speaker. I rise today to speak about the work of the Standing Committee on Justice Policy and about why this motion matters, not as a procedural step, but as a commitment to finish the work that so many people have invested in over the past year. The Minister has spoken about why our government recognizes intimate partner violence as endemic in Ontario. Not a temporary surge, not a passing crisis, but a pattern rooted in our systems and sustained across generations. I want to begin there because I believe that that framing matters. Calling it endemic is not about softening the issue or about dismissing it. Ultimately, it's about accuracy. It's about honesty, and it's about telling the public that we see this for what it is, a persistent structural problem that will only change through an equally persistent and structured response. That understanding shaped everything the committee did. It guided our questions, our decisions, and our sense of responsibility. Because once you name something as systemic, you commit to acting systemically. When the House created this committee, the task was not simply to hear from experts or summarize testimony. The task was to translate years of experience and evidence into something lasting, something that could stand up to the weight of implementation. We weren't creating awareness. We were building the architecture of change. This study was an unusual exercise for government. One of the few times that elected members have led such an incredibly broad cross-sector review. This was government-led and government-driven. Elected officials, not external consultants, taking responsibility for a problem that cuts across multiple ministries and touches the lives of countless Ontarians. But it was also informed and enriched by the people who live this work every single day. The experts, the advocates, the survivors, the frontline workers, the researchers, the police, the lawyers, the educators, the healthcare staff, the shelter directors. That partnership was the foundation of this process. It showed that government can lead and listen at the same time, that the discipline of governance and the expertise of those on the ground are not opposing forces. They are complementary ones. And that, I think, is what people expect of us, not slogans, but structure. The committee's work began in the spring of 2024. Over months of hearings, we heard from more than 150 people, around 90 expert witnesses and 60 survivors, representing many regions of this province and every part of the system. We received detailed written submissions. We reviewed national and provincial frameworks. We studied the full transcript and recommendations of the Renfrew County Inquest, which examined the tragic murders of Natalie Warmerdam, Carol Culleton, and Anastasia Kuzik. These tragedies and the evidence gathered from them reminded us why this work matters so deeply, because ultimately the cost of system failure is measured in lives. And that is why, as I built this report, I organized it not by ministry, but by issue area, by the real conditions that drive risk and shape prevention. Because ultimately, violence doesn't fit neatly within administrative boundaries, and neither should our response. When the same patterns of risk appear in police files, in courtrooms, in hospitals, and in classrooms, it tells us that the system isn't fragmented by chance. It's fragmented by design. If the problem crosses jurisdictions, then so too must the solution. That approach wasn't about novelty, it was about responsibility. It was about taking the discipline that we apply to fiscal planning or to healthcare, to infrastructure planning, and applying it to intimate partner violence and sexual violence, with the same seriousness and the same expectation that what we build must endure. The report I prepared, and which we must now review, is structured for use. It is meant to be worked with by this House, by ministries, by partners across Ontario who have asked for clarity, coordination, and a plan that is stable enough to last. This brings me to the step before us today, the motion that allows this committee's work to move from evidence to adoption. This motion is the next stage in that work. It allows the committee to meet on scheduled days to review and adopt the draft I prepared on behalf of the committee and to table it before the legislature in advance of the winter recess. It ensures that every member of the committee has the opportunity to engage with the document, to reflect on it, to add perspective to it, and to bring the work to a formal conclusion. It doesn't reopen the evidence or relitigate the testimony. It formalizes what has already been done. It turns months of listening into something concrete and public. And that matters, because every person who appeared before the committee, every survivor, every professional, every advocate, did so in the hope and the belief that their time and their courage would lead to something. Finishing this process is how we honor that belief. It's how we show that when Ontarians engage with their government in good faith, their contributions are not absorbed and forgotten, but translated into action. And that, Speaker, is ultimately what credibility in government looks like, evidence turned into results. People will ask, why now? Why this step and why this timing? And the answer is simple. This is where the process leads. The evidence has been gathered, tested, and synthesized. The findings are clear. What this motion does is move that evidence from the committee room into the legislative and public space where it can be acted upon. That is not delay. It is due diligence. It's how we show respect for the seriousness of the issue and for the lives affected by it. We would never ask a coroner to rush an inquest or a court to skip deliberation. We owe the same care to this process grounded in evidence. And Speaker, there's another reason that this motion matters. Continuity. It tells victims, advocates, and the public that this legislature values completion as much as initiation, that we finish what we start. This is also about making knowledge usable. This work has never been about discovering something that no one knew. It has been about connecting what we already know in ways that support action. Ontario does not suffer from a lack of awareness about intimate partner violence. It suffers from fragmentation. Every sector sees a different part of the problem. The point of this motion is to review the report that brings those parts together and makes the knowledge we already have usable across systems, to translate converging evidence into a single, durable foundation that ministries and partners can actually build on. And that's not abstract. It means aligning prevention in schools and in sports and in what frontline services are seeing every day. It means making sure that the justice system's modernization efforts are fed by consistent information and shared definitions. It means building common indicators across ministries so that when we talk about risk or throughput or victim stability, we are talking about the same things and measuring them in the same way. That is the practical value of this motion. It pulls the threads together and sets the table for implementation. Some may hear all of this and say, why doesn't the House simply declare and be done? Because declarations do not repair systems. Declarations do not coordinate calendars. They do not align training. They don't define data fields or stabilize base funding. They are expressions. They are not architecture. This motion and this report is about architecture. about taking the record before us and turning it into a structure that can hold the next phase of work. It also says something about trust. Public confidence in institutions is built on two things: transparency and consistency. Transparency in making the work visible, and consistency in finishing what we start. This motion commits to both. It says to the people who came before us that no, we will not abandon their testimony at the last mile. It says to ministries and to partners that the legislature will deliver a record that they can plan against. And it says to victims that their courage was not a one-day headline. It is the foundation for change that will endure. Now, I want to be clear about something else. This is not about casting blame or about pretending that the work began today. It doesn't and didn't. This motion recognizes the work already done by frontline partners, by public servants, and by the many communities that on their own have been building pieces of this response for years. This motion creates the conditions for those pieces to connect, to move from excellent initiatives to a system that functions as one. That is how government demonstrates respect for the people doing the work, by giving them something stable to work within. There's a practical rhythm to this, Speaker. We listened, we analyzed, we structured, and now we must review, adopt, and table so that ministries can align what they are doing with what this House and this committee has heard. It is a disciplined process, and discipline is what the public expects from us. The scale of this issue demands it. The complexity of real-world implementation demands it. And frankly, the people doing this work on the ground, day in and day out, deserve it. For those following this debate who might worry that formality will slow momentum, let me say this. Formality is what keeps momentum from scattering and becoming lost. A formal adoption and tabling is not the end of urgency. It is the beginning of accountability. It gives us dates and deliverables and a common text to work against. It allows the government to respond in a structured way, and it allows partners to see where they fit. It replaces improvisation with a plan. And for an issue this serious, improvisation is simply not good enough. I also want to acknowledge what this motion is not. It is not an attempt to relitigate testimony or to trade headlines over language. The conversation about words has happened in public for years. What the people who came before us at committee asked for was not better adjectives. They asked for better systems. This motion is how the legislature does its part to deliver those systems, by completing the committee's mandate and placing a coherent record before the House. We are not starting over. We are finishing the phase that makes the next one possible. And finishing matters. As legislators, we all know how many good intentions end in drafts and working groups and pilot projects that never quite become policy. This motion is the opposite of that. It is the legislature choosing follow-through, choosing to turn testimony into something that can be evaluated, implemented, and improved over time. So when people ask, why now? The answer is because the work brought us here, because the report is ready for review, because this is the point in the process when the committee's work moves from review to report, when evidence becomes part of the public foundation for whatever will come next. And because in government, courage is in consistency and in seeing the work through to the end. To understand why this motion matters, it's worth covering what the committee heard and how consistent those messages were. Across every sector, one truth repeated itself. The challenges of intimate partner violence, of sexual violence and violence against women are not random. They are systemic. And because they are systemic, the solutions must be as well. After months of testimony, certain truths emerged, clear, consistent, and impossible to ignore. First, that violence is not a series of isolated incidents. It is the outcome of social and institutional conditions that interact with each other. Poverty, untreated trauma, addiction, housing insecurity, and outdated systems of accountability all contribute to risk. These are not root causes in the abstract. They are daily realities that cross generations. And when we understand those realities, one thing becomes obvious. Prevention works. Reaching people early, engaging boys and men, providing education and community supports, these interventions are measurable, effective, humane, and essential. Several witnesses emphasize that the first signs of risk appear long before adulthood, in schools, in sports, in families under stress, and in communities where isolation becomes a pressure point. Intervening early isn't theoretical, it's practical prevention. It also means meeting people where they are. That's why this report highlights the importance of community-based programs that teach healthy relationships, conflict management, and respect in classrooms, on sports fields, and in workplaces. Coaches explained that conversations that start in sports can change how young people think about leadership and responsibility. Educators spoke about students who, after learning how to identify controlling behavior, recognized it in their own peer groups. Workplace representatives described how training on psychological safety and harassment prevention translates into earlier reporting and fewer escalations. These aren't abstract cultural goals. They are tangible early intervention tools. Prevention is not something separate from public safety. It is public safety in its earliest and most effective form. The second truth was about structure. Even the best prevention efforts require systems that can respond quickly and consistently when risk becomes immediate, and that brought us to the justice system. The committee heard clearly that modernization, not overhaul, but modernization, is essential to improving outcomes across Ontario's justice system. Witnesses spoke about how case flow, information sharing, and court scheduling all intersect with victim safety. What the committee saw was not a lack of dedication. It was a system working at full capacity within structures designed for another era. Police, Crown's defence, and victim service partners are already adapting. Across the province, integrated bail teams and specialized intimate partner violence courts are helping ensure that high-risk cases are identified earlier, managed efficiently, and resolved safely. Those models work because they link data and human judgment, and because they treat information as prevention. What modernization means in this context is clarity and coordination, consistent risk assessment tools, standardized information flow, and technology that allows all justice partners to see the same facts at the same time. It also means supporting the Crown function, ensuring that prosecutors have the resources, the digital tools, and the interdisciplinary connections that they need to make informed decisions about bail, plea negotiations, and case progression. Witnesses told us that when prosecutors have access to complete histories, risk flags and assessments, prior breaches, community supervision notes, they can craft safer release plans and more appropriate resolutions. But when those histories aren't visible, opportunities for prevention are lost. Modernization is about closing that visibility gap. The report recommends a coordinated data environment for justice partners, emphasizing that consistent information sharing protects both fairness and safety. It also highlights the importance of specialized training for Crowns and police alike, not as a criticism, but as reinforcement. Ultimately, the system's strength lies in its people, and modernization supports them by giving them the tools and the clarity that they need to do their jobs well. In short, the justice modernization agenda is not just about rewriting laws, it's about making the machinery that enforces them work better. It's about efficiency as safety, communication as prevention, and technology as support for judgment. That's what the committee heard, and that's what this motion helps to advance. the translation of those recommendations into policy and practice. From justice, we turn to those who catch what the system misses, the frontline service providers who support victims, operate shelters, provide counseling, manage crisis lines. Their testimony was some of the most compelling that we heard. They described exhaustion that goes beyond workload. Many spoke about the emotional fatigue that comes from operating in permanent crisis mode, the constant triage, the relentless scarcity of time and funding, the feeling that even success is temporary because the program that worked might not exist next year. Frontline workers told us that stable funding is not about comfort, it's about safety. Predictable budgets mean predictable staff, which means continuity for victims. Every time a shelter closes a bed because of staffing shortages, or a counselor leaves because the program-funded term ended, the system loses capacity that takes years to rebuild. The sector's greatest strength is in its people, and retaining them requires stability. The committee's record highlights how predictability in funding and planning improves safety and outcomes. When agencies can plan beyond a single fiscal cycle, they retain experience and provide steadier support. That stability for workers becomes continuity for victims, and continuity is what protects people and improves outcomes. We also heard that collaboration among service providers improves both efficiency and morale. When agencies know what their counterparts are doing, when shelter staff can coordinate directly with police, when counselors can connect seamlessly with housing officers, duplication decreases and trust increases. That trust is the unseen infrastructure of prevention. It allows every dollar, every hour, and every act of care to reach further. And so, Speaker, when this motion calls for the adoption and tabling of the committee's report, what it really calls for is respect. Respect for the professionals who keep these systems standing, respect for the survivors who have asked us to do better, and respect for the public who expects a government that plans as carefully for safety as it does for finances and infrastructure. Completion of this report is a visible sign of that respect. The committee also devoted significant time to prevention beyond government, to the spaces where culture and habit are shaped: schools, sports, workplaces. These are the everyday arenas where attitudes towards respect, equality, and consent are learned long before the justice system ever becomes involved. In education, we heard about the value of consistent, age-appropriate curricula on healthy relationships and digital citizenship. Experts told us that when those lessons are standardized and reinforced year over year, the students carry them forward into adulthood. That is prevention that compounds, small interventions today, producing safer communities tomorrow. In sport, coaches and administrators describe programs that pair mentorship with accountability. Initiatives like bystander training or safe sport certification don't just protect athletes, they model how leadership and empathy coexist. Sport reaches audiences that policy alone cannot. It changes behavior through participation. When we invest in safe sport frameworks, we are investing in a generation that will see strength and respect as inseparable from one another. And in workplaces, employers emphasize the need for awareness and flexibility, policies that recognize signs of abuse and ensure that economic dependence is never a barrier to safety. Employment is prevention too. Financial stability is one of the strongest predictors of long-term safety, particularly for women leaving abusive situations. These community-level efforts reinforce everything that the committee heard about systems. Prevention is not a department, it is a culture. It exists wherever people learn how to treat one another. Government can support it by aligning programs, by funding evidence-based education, and by ensuring that the ministries responsible for education, for sport, for labor, coordinate continually with those responsible for justice and for community safety. The report emphasizes that prevention is most effective when it is measurable and repeatable, when it can be taught, evaluated, and scaled. That's how we move from promising pilots to lasting policy. And that's how we make sure that the lessons learned in classrooms, on the sports fields, and in boardrooms add up to a safer province overall. When you combine all of these strands, prevention, modernization, workforce stability, community engagement, what emerges is a framework for permanence. Each strengthens the others. Prevention reduces caseloads. Modernization accelerates response. Workforce stability sustains quality, and community engagement shifts culture. That is the architecture this motion will help us build upon. And, Speaker, it is architecture built to last. There is one more layer to this discussion, the way that we measure what works and how we hold ourselves accountable for results. Every witness, every ministry, every partner organization reminded us that you can't manage what you don't measure. Ontario collects a vast amount of information, but until it's coordinated, we can't see progress clearly. And this is about accountability, not bureaucracy. A shared data framework lets us see where prevention succeeds and where response falls short. It allows policymakers to identify which programs genuinely change behavior, which approaches reduce repeat offenses, and which investments yield stability for victims and communities alike. Data is not about counting cases, it's about counting change. The committee heard strong support for a provincial data standard, one that connects justice, health, education, and social services through common definitions and indicators. When those indicators are public, they give the sector and the government the same view of progress. That transparency builds trust. It allows us to celebrate our successes honestly and to correct course quickly. Evaluation also matters for prevention. If an early intervention program in a school district shows measurable reductions in youth violence or improved conflict resolution skills, that success should inform the next curriculum review. If a pilot project in a northern community reduces recidivism through culturally grounded supports, that model should be adapted, expanded, not reinvented elsewhere. Evidence is what allows innovation to scale. The committee's report highlights the need for regular public reporting on outcomes, precisely so that success becomes self-sustaining and failure becomes visible early enough to fix. To be clear, this is not about auditing compassion, it is about protecting it. Good data keeps good programs alive. It gives taxpayers confidence, and it gives frontline workers the proof that their labor is making a difference. It transforms stories into statistics that guide policy, and then back again into stories of people whose lives are safer because we paid attention. Finishing this report is not only a moral obligation, it is stewardship. Every incident of violence triggers a response across multiple systems: police, healthcare, housing, child welfare, courts. Those responses are heavy, not only in financial terms, but in human capacity and in time. The committee heard that coordination and prevention lighten that load. They reduce duplication, shorten crisis cycles, and free skilled professionals to focus where they're needed most. When we plan carefully, compassion and efficiency reinforce each other. Each successful early intervention prevents countless hours of emergency work later. Each stable program reduces turnover and preserves expertise. Each act of planning is an act of care. That is what stewardship looks like in practice. Compassion organized well. And compassion organized well is how we honor both the people we serve and the people who serve them. And that, Speaker, is what this motion represents. It's not a gesture It's a mechanism. It's the way that we convert analysis into policy and policy into practice. It's how what was learned could become what is done. Throughout this process, members from every party contributed. We asked hard questions, and we listened to some extremely difficult answers. And I believe that we shared the same goal: safer communities, better coordination, and fewer victims. This has been, I think, a rare space in politics, one that felt defined more by shared resolve than by competition. Every member brought the realities of their own communities and often their own experiences into the room, and that diversity made the work stronger. Recognizing the endemic nature of this violence, again, is not about avoiding blame, it is about accepting responsibility. It means the work doesn't belong to one government or to one party. It belongs to all of us. And that shared ownership is what will carry this work forward, beyond today's vote, beyond this parliament, beyond any single mandate. Because ending violence isn't the project of a year or a report, it is the work of a generation. And this motion ensures that the groundwork endures. It outlines a possible roadmap that any government can follow, that ministries can coordinate around, and that communities can hold to account. That continuity is the opposite of complacency. It is the structure that will keep urgency alive long after the headlines fade. Speaker, this has been some of the most demanding work I personally have ever done. I've spent thousands of hours on it, and I think at times pushed my own brain and capacity to what sometimes felt like well beyond the breaking point. But it has also been by far the most meaningful, the most rewarding, and the most personally impactful. I want to speak for a moment to those that may be watching now or later, those that work in this space, those that have been hurt by this insidious social problem, and say that as somebody standing in this House, as somebody that served on this committee, involved in its design, involved in the testimony, involved in this report, the people in this House care so deeply for you and for this issue. Thank you. I have lost count of the number of members on all sides of the aisle who have come up to me and done the equivalent of sort of a clap on the shoulder to say, thank you, we're doing really important work here. And we are. I said before that this was an unusual committee, and I think that the breadth and depth and fiery passion of care that went into it from all of the members in this legislature is what made it such. It's what made it persist across election cycles, across Trump presidencies, across everything, because of the amount of care that we have. And what it really reminded me of, which it was interesting, I say often that I came to politics in a bit of a diving in headfirst perspective, where I had never followed politics before. But doing this work, it reminded me, and I think it has reminded all of us, that good intentions aren't enough. Slogans aren't enough. Headlines for a day aren't enough. And performance for the sake of performance alone is not enough. Structure matters, process matters, follow-through matters. Together, we've seen that serious issues deserve serious processes, and that government, our government and this chamber, can meet that standard when we come together. To every person who appeared before the committee, every survivor, every advocate, every professional, thank you. You trusted this legislature with your experience, and that trust is what compels us to see this through. To my colleagues across the aisle, thank you for the passion that you brought to this work. We may not agree on every policy detail, but I do believe, and I want to believe, that we are united in purpose. Now it falls to us to finish the process, to pass this motion, to review and table the report, and to begin the next phase, turning evidence into implementation. Recognizing that intimate partner violence is endemic means committing to endurance. It means understanding that prevention and response are not projects with end dates. They are core responsibilities of government. This motion is one way that we affirm that. It's how we show Ontarians of every background and every belief that the legislature they elected is capable of disciplined, collaborative work on an issue that touches every community in this province. It's how we ensure that what we heard doesn't stay in transcripts but becomes part of how Ontario governs itself. Speaker, we and so many, many more that came before us have mapped the terrain of this issue with care over years. We know where the barriers are and where the pathways begin, but ultimately the time for mapping is over. We've built a road, and now is the time to travel it. Let's pass this motion, finish the work, adopt the report, and take the next step together towards the safe and flourishing Ontario that every survivor and every citizen deserves. Thank you, Speaker.